everybody. Welcome back to the Female Footballers Podcast.
Hi, everyone. Welcome back to the Female Footballers Podcast.
Oh, Lisa, welcome to the podcast. How are you?
I'm good. Thanks for having me, Cassie. I'm excited to chat it up with you about some really important topics.
Yeah, and we have Rachel on. Hi, Rachel. How are you?
Hi, everybody. I'm great.
Excellent. We're coming to you to talk about a really important, pertinent topic for Mental Health Month, which is May. And we want to discuss this. This is a conversation that should happen all year long, not just 1 month of the year. But we're going to kind of dive into really important topics that I feel like get lost in translation and that really need help being defined in more clinical terms that will help coaches and parents understand players a little bit better and some of the mental health struggles they face within sports. So let's dive in. So first of all, here at Female Footballers, just like you, Lisa, we are strategic partners, as everyone knows. We're both dealing with youth, collegiate, pro athletes who are, struggling with their mental health. We're on more of the youth side, and some of the statistics we can note that are of importance in what we're doing is, we have 79% of girls, according to the ROCKS report, that say they're going to explode due to pressure. We have 67% of girls from that same report feeling that they are in competition with one another. We see recently the NCAA came out with a stat that suicide is now the number one cause of death at the collegiate level. There's stat after stat after stat coming out about the struggles athletes are facing. For us, we're seeing that at the girls 12 to 18 range. We see struggles with ruminating over negative self-talk, struggles with their role on the team, starting, not starting, injuries. We're seeing the need for resilience around tryouts and ID camps and mistakes and mental toughness moments and dealing with a system with tiered teams and lots of different levels and the comparison issues amongst teammates. And so there's so many. I would love to hear from you. What are some of the things people come to you about? What are some of the struggles you're seeing in your practice at all different levels?
Yeah, thank you. There's so much that we can talk about. So there could be, as a medical provider, as a licensed clinical social worker, psychotherapist, there's a set of issues there. And then as a mental performance consultant, there's a set of issues there. So you and I partner because you guys focus on the mental skills development. And then when there is an athlete that might show some signs and symptoms, and we can talk about that would benefit from a medical health provider, because mental health is medical health, is health. Then that's when we can collaborate and care for this athlete holistically. So when it comes to, I don't want clinical to be this big word, but when it comes to how anxiety and stress start to impact an athlete's level of functioning, their inability to show up to school, to their sport, to their relationships, to their chores at home, to their sibling relationships, that's when a medical health provider like myself can come in and help out when it goes beyond the pitch or field of play. So when it comes to that, it's when I get injured and I suffer a loss of my ability to play the same way I was playing, to travel with my team, to connect with my teammates who are sisters in the same way, that can cause, if unidentified and unaddressed, a depression. There's grief there, because we process that loss. But if not attended to, or given, the player's not given a place to process, that grief can become depression, and we don't want that. So normalizing that when you have a loss, as from an injury or a loss of transitioning from maybe high school to college or college to pros, there's a loss even though there's something new. So a loss of what that was, that community, those people, those friends, and to normalize that when you lose something, you're going to grieve. And grieving can come at different stages. You can be sad, depressed, angry, in denial, want to bargain in your own head about what it might be. So we want to give the athletes spaces to talk about that and to process it, whether it's creatively, verbally, written, so that it doesn't go into a depression that can possibly be debilitating.
Excellent. Yeah, I think that's huge. And I think what we're working with a lot of youth players and coaches will come to us and say, I don't know what's going on. My players are so soft these days. These kids these days, they're so soft. They don't know how to process the struggle. This is just part of the game. Like, these are things we hear. So we use the word struggle, and we're trying to help normalize that there's an element of the game and a need for resilience when you hit adversity. That is a part of sport, right? That we learn to overcome challenges and move and have emotional agility through mistakes that we make. And we're trying to educate players, coaches, and parents that that is an element of the game, but that it's an element of the game, like you just mentioned, that needs attention, like deliberate and consistent practices around what's happening. And a lot of coaches are like, no, this is just stuff we were born to know and we just had. And I would love to hear your thoughts on this, because it's really, it's frustrating. We get pushback. Rachel and I were at the United Soccer Coaches Convention at a table with our podcast, and coaches were coming up. And I mean, Rachel watched me kind of go back and forth with this guy trying to explain like how necessary all of this is. And I would love for everyone to hear from your experience and your expertise. Like, what are your thoughts on that?
Yeah, it's so interesting. I mean, I'll say, because I know you've been at those conferences and others where there's high visibility and opportunity to have these conversations. I just came from Chicago, the She Believes Summit, put on by U.S. Soccer and Deloitte and Visa and Coke. They all had a role in it to make it a very nice event. It was not like on the panel discussions of former U.S. women's national team players talking about their, like, who they were then or what they would say to themselves then when they were playing. It became a whole mental health conversation, like just organically by what was going on in the room and between the panelists and things like that. So it's they wish that there was a little bit more education and understanding like that this generation is getting. But I try to regulate my emotions when people are just saying, just suck it up, because that's what I did. Like, back in my mind, I'm like, just because that's what you did doesn't mean it's right and the most healthiest.
Mm-hmm.
Like, generate the coaches' emotional intelligence around how they can impact their athletes definitely has a lot to do with how they were coached and what generation they have come from. There is still a lot of stigma and barriers to actually having a conversation about what is mental health, mental fitness, resilience, mental agility, because people think mental health is like a serious thing that I don't even want to go into or talk about, because it's going to make me go down this road that I don't feel comfortable with. I would want everyone to understand that mental health is how we think, feel, and behave, and that we have agency and control over those things. That if someone has an emotion, it doesn't mean you're soft. That's a judgment based on your lived experience about how you are interpreting it. That is not a fact. Last night, I was presenting to some coaches at a prep high school in San Francisco, and I was like, one of the coaches was like, "Oh, if I ask them how they feel, they might say something like overwhelmed, and I don't know what to do with that." Well, here's what you do. You ask a little bit more about, what do you mean overwhelmed? Can you give me just a couple, like a little bit more about that? I hear you. I got you. You think you can perform in a way that you'd feel good about yourself in practice today? Is that overwhelm something that's going to keep you? No, it's good. I just want, you asked me how I was doing, so I just told you. I don't want coaches to feel intimidated that like you have to do something now because they're overwhelmed, or it means like if I push them too hard in practice, they're going to like, have a mental health crisis, and I don't know how to handle that. Being, you know what I mean? Being coaching mentally fit student athletes or collegiate athletes is feeling comfortable asking how they're feeling physically and mentally in one sentence, in one conversation.
I think that's a big piece of why I have actual friends who've gotten out of coaching for that reason. They're afraid of this pathway and not knowing what to say. They feel like all of a sudden they need to be an expert at this. And I think the hard part is we're saying at Female Footballers, it's your job to ask more questions. It's not
Yes.
your job to be an expert at everything. Just like, we hire these coaches based a lot of the time on their expertise in the sport. And that
Yes.
seems to be the number one thing. But I do think there has to be an element of understanding the age group and development appropriateness of the people you're coaching, whether that's youth and knowing a little bit about youth development or collegiate development. What are they going through? Doesn't mean you have to be an expert on it, but it is going to come up as parts of your job, and you do need to kind of lean in a little bit to it. Am I wrong there?
No.
Yeah.
You have to be educated on the signs and symptoms.
Mm-hmm.
You are. So this is not funny, but a lot of coaches were athletes themselves. So they are going to have that perfectionism attitude of like, I need to be everything for everyone. And I need to do this, even if it's hard, and not feel like you can ask for help or build a team around a player. Like, you're one person and you have an expertise. We respect and honor that. Yes. But you have the athletic trainer. You might have a mental performance coach. You might have a clinical psychologist, all within your, reach to be able to do that. At AthMindset, we talk about like, we want coaches to coach. That's what you're licensed in, coaching. We're licensed in mental health care. And so let us partner with you to give you that confidence and tools and information to help you be able to see, like, when it starts to bump up against this is when I can bring in a mental health professional, a licensed mental health professional that can then consult with you, run by what's going on, and then say like, oh, hey, athlete A, this is a good person that you can talk to. Let me like do a warm handoff and introduction, and let's like bridge this. Mm-hmm. Being okay to not know everything is a parallel process between the athlete and the coach. The athlete wants to feel like they have to know everything and be perfect and not make mistakes, and so does the coach on some level. Like, allow us all to work together collaboratively. That's the best for the coach and for the student athlete.
Mm-hmm. Oh, I love that. Rach, did you want to ask anything? I didn't mean to.
No. I obviously love everything you're saying. One of the things that I was thinking about was when as a coach, because coming from an educator background, you get your class of kids and you're having to sort of assess each of them, like in how they're doing that day and on the long term, right? And that's the same concept for a coach. Like, my job is to, develop you throughout this season, whatever, season that is, college or club, or maybe just this fall season or whatever it is. But also as your job as a coach, because you spend a lot of time with this person. You're an adult, for the players we work with, who sees this child regularly. And coaches need to recognize how valuable they are for mental health. And I love what you're saying. Like, we don't need to make this scary. It doesn't mean you have to be the expert. It just means you need to be human and have that kind of relationship where you can see, like, I know my player, because you should be working on that stuff anyway, because that's how you're going to motivate them. It's by getting to know them better. You have to learn all your players and differentiate how you coach your different players, which is going to allow you then to recognize when something's a little off and recognize, this is really off, or, oh, this is just a little blip, or like that player said, oh, I'm feeling overwhelmed. What do you mean? What are you overwhelmed with? Oh, I have this big test tomorrow. I'm just like, I have so much today and I had a test today or whatever. Oh yeah, that sounds like a lot. Like that right there, if they say, oh, I'm overwhelmed, I have, whatever, I have a big test tomorrow, I have something this weekend, I don't know when I'm going to finish all this. Like you said, well, are you going to be able to perform? And then, again, this is that questioning, and it's not meaning you have all the answers. It's just like, okay, well, maybe you need to take, a little bit of time today away from practice to make sure that you're not going to.
Yeah. What do you think you need?
Yeah. What do you think you need? Perfect. Just having that. Yeah. And normalizing that it's hard. This is hard. And especially, I think, the club soccer, we practice a lot now. players practice a lot, and the high
Yep.
schools practice even more. When it is high school season, it is constant, and those are student athletes, and they are having to juggle a lot. And so I think
Yep.
it's really important. And, a lot of coaches in the high school space are educators. So I do think they probably have a little more of that, just based from their teaching experience as well, because this has been integrated into the schools for longer than it has been integrated into sport. But I think it's still going back to the ego. Like, this is not knocking any of your expertise. This is just you elevating your player by having that conversation to allow them to, because again, and you're that first line of defense, which is what my point is, going back to, like, or not first line of defense, first, you're a frontline adult working with these players. And so that should be part of what you're regularly assessing. And it doesn't need to be like, I'm doing a mental health check. It's just, that's part of
Ask a
integrating
question.
that. Yeah.
Mm-hmm.
And this is one, every coach that's listening, how are you doing today mentally?
I think one thing we notice, at least with working with soccer clubs, and we're working with clubs all over the country. So some are in some of these bigger leagues like the ECNL, the GA, some are not, some are NPL, whatever, all the different acronyms. What I'm finding is very rarely do soccer clubs and even large clubs have an athletic trainer. And if they do, it's 1 to like 900 kids, and it's sort of like, I think we're getting pushback on, like, this isn't a part of my job. And like Rachel, you said, as an educator, and I come from that same background, we see our jobs as, our job is to differentiate our instruction to meet the needs of each individual child in that classroom. I think there's a disconnect a little bit in the youth level with coaching a player. I think that we do still have, and this is where it's in line with this mental health issue that I'm seeing in youth soccer, is some coaches do not think that this is a part of their job. Rather than differentiating their coaching to meet the needs of the group, they are expecting the kids or the players to meet them where they are at their style and standard of coaching. I think those are more the old-timey coaches, and maybe that's happening less now. But it's weird how I love right now we're in a space where, like you said, the She Believes, everyone's talking about it. I find it so invigorating to see these conversations happening at the pro and college level. And it's like, oh, we're getting somewhere. And then we're working in this youth market, and it's like, are we getting somewhere? Because I'm dealing with pushback from coaches who are like, this isn't part of my role. These kids are just soft. And I mean, back to some of those, struggles, I think, if I could, I would change the system so they wouldn't have to experience all of this, right? We know from experience that going through hard times and having to overcome some adversity does help you grow and become more resilient. And that is a really great skill to learn and have throughout your life. But I think what's happening is there's this disconnect at the youth level of education around this. And so the coaches are unsure if it's their role, and if is their role, they don't even know the terminology to use. And then if they don't feel like it's their role, there's nothing being happening, right?
What if a kid had a physical injury? You're going to, it is your role to refer them maybe to their parent, and then maybe to a physical therapist or a doctor to assess. Why wouldn't you not do that? Why is it not in your role to do that if there's a mental health condition happening or a mental concern?
Absolutely.
So again, you are not going to provide physical therapy to your athlete. That is not your job or your profession. It's illegal. You're working outside of your scope of training and competence. Same with mental health. We're not expecting that. Building a referral source or a team behind the player is something that is your responsibility, to recognize what is my role and what is not. And here are the other experts and other people who can take care of the athlete holistically.
Mm-hmm.
And that does not, like, an ego thing of like, oh, I can't do that, I don't know how. Like, you're not trained to. Why would you even try? You could even do a disservice to an athlete. So at the youth level, it's actually bringing in the parents, and also a parent could administer this online, these 2 surveys, or be able to say, hey my kid, I need you to talk to your coach about this. Here are the points. I want you to role play with me so that you can go talk. I will not talk for you. Unless maybe like you 14 and below. Yes. You 16 and above. that is a skill that they should learn how to do. Advocate for themselves to their coach. It's a relationship, an important one. But it varies from level to level, like you're saying. But I think that if we put it that way, you would refer your kid to see a physical therapist or a chiropractor or a massage therapist, maybe, or something like that. Why is this any different? Well, it's the stigma still. It's the stigma, lack of education, and lack of awareness about what mental health is and what it isn't. I'm going to take the time, Cassie and Rachel, real quick. Mental health, we all have it. Just like we all have physical health. We all have mental health. We all live on a continuum. Because as we do in physical health, some of us are physically more healthy. Some of us are recovering from injury. Some of us are injured. We might, we don't know exactly what's going on with someone inside or in their body. Same with mental health. It's invisible. We don't know unless it's a trained eye taking a look. But we live on a continuum. All of us do. 1 in 5 of us has a mental health struggle or a mental health ailment, just like we would physical. But we all have mental health because it's how we think, feel, and behave, how we respond to adversity, and build resilience. It's that mindful and skillful response that builds resilience, knowing that there's going to be adversity. Why are we surprised when there is? Life is going to deal us a card. What's our response? So my wish is for all coaches to feel like mental health is not a serious thing. It's just how they think, feel, and behave. Like, why would we not care for that? So the more we talk about, the more action behind the awareness is key. We can be aware all we want. We can talk all we want. Let's do something now.
Ugh, love it. I love it. 100% agree. And I think this is where, when it gets into the notion, and we get hit up a lot. I got a call 2 weeks ago from a coach who was like, I have a player who's, she can't come to practice. She's having some serious eating disorder issues. And, I don't know what to do. Like, can you talk to her? And I had to straight up say, like, I'm not a nutritionist or a doctor on this. Like, I'm happy to talk with her, but I would much more be happy to refer her to somebody. And, he's like, oh, I think they're already seeing somebody. What was that?
So an eating disorder is a mental health condition.
Completely. But I think this is where our scope and sequence of what we do at Female Footballers is we're talking about social, emotional skills, everyday skills, the same type of skills they're learning in a school setting that are not at the level you're talking to them about, right?
Cassie, that's why we're strategically partnered, right? Exactly. That's the beauty of it. Exactly. I have the exact person you can talk to, Lisa Bonta Sumii. She's this, and this. And you can say whatever you want about me. And she heads up AthMindset. She's a licensed.
Just so you know.
Yeah. Because then that takes it off of you too, to feel pressure like you have to do something.
Yeah.
Right? That's not for you. I want people just to hear how our strategic partner works.
Yeah. No, that's why I brought it up.
Like, for them all to hear, like, that's the way that we can bring our strategic partner to life. And that's what we do.
And that is how it works. And that's why I brought it up. And I think this is where coaches, though, are, like you said, really scared. And even coaches struggle to know when it becomes more severe. What are some other things, maybe from a parent perspective, because we have a lot of parents that listen to this podcast, how do you know when it's your, I know as a parent of 3 kids, and Rachel has 3 kids, like,
I got 2.
Yeah, like we all know as a parent when something's off with our kid, but we also aren't sure. And I know for me, I have a 13-year-old son about to turn 14. I don't know sometimes if this is quote unquote normal or typical behavior because it's my firstborn going through this. And I'm not sure how, if I need to let him sit in some of it to learn, or if I need to refer him to more of a supportive space that I am not an expert in. Like, what do you say to parents when they're not really sure?
Well, kind of back to what, because it's okay to not be sure. It's normal to not be sure. We learn as we go, because even with our second or third kid, they're going to be different than the first. And so they're teaching us how to be with them. And so we need to be open to that. Just like a coach needs to learn how to coach to a specific human being who happens to play a sport, we are learning how to parent each of our kids differently because they're different human beings and have different needs. My 2 kids are totally different. And parenting shouldn't be just a unilateral thing and one person doing it. It can be a partner that we have in the home. It can be a trusted auntie or best friend or godparent or something. We all do it together. And we ask. We're curious too about our own kids. Like, what do you see? Like, this is what I'm seeing. What do you think about that? and not feel like we have to know everything. Just like the coach don't even know everything. Parent don't even know everything. We learn as we go and have a growth mindset about like, what is this kid in front of me really asking me for, and having a collaborative conversation with them.
Oh, I love that. I love
You know,
that.
and I don't know if you know too, the AthMindset workbook, me and Dr. Tiana Woolridge just came out with it about 6 months ago. That's becoming a real sort of reference point for parents. It's easy read. You can sit down with your kid. There's QR codes, there's exercises. It's in big writing. We have our avatars, like, but we actually, between the two of us, represent 4 professions. So it's packed with all kinds of different knowledge in there. That's easy accessible for anyone at any age. And so that, if you're not sure, you know, pick that up and like read that with your kid, read it with your partner, like, oh, let's implement this or that, or let's do this exercise together actually, and then share. Like, let's look at this QR code and watch this video on how to meditate. Sweet. Like, so there's resources there, and there's a whole bunch of resources in the back of that book too. But like, I don't want it to feel like daunting. And that could be for coaches, you know, anyone, an athlete themselves. All my athletes have a copy. So it's out there. It's just who to ask, where to look.
Mm-hmm. I think a lot of the time, like what you said in the beginning, I think people fail to do their research and their homework around the developmental age that they're working with. I mean, even at the college level, you've got coaches who are experts at the technical, tactical, physical elements of the game and really don't do the work on themselves on learning what is a college player going through right now in today's landscape, not in the landscape that I played in. And I think parents are doing the same thing. With those coaches that are saying these kids are soft, you're thinking about a time period you might have gone through, and those pressures on those kids were completely different than the pressures that are showing up for these players now. So doing your homework, do you have any good resources for parents or coaches to, like, I mean, obviously your website I think is a great resource. Other places you send them to learn about, I mean, obviously you can Google it too, but anything you use that you pull for your clients that it's like, learn about what a 13-year-old's pressure is. Some of those stats and research that we do, I find super helpful, and we share them a lot too. But what's your go-to?
Yeah, I mean, I am unique in that, like, I want, not unique, but like I uniquely address the question that they have. So it's like, my kid is like sleeping forever. Are they depressed, or or what's going on? And so like, I try to learn specifically about it. But I think, you know, Google with any like medical or psychological name attached to the source that you're looking at is going to be more credible and accurate. Psychologytoday.com has a lot of articles on different aspects of psychology, of youth psychology and development. So you can like Google psychologytoday.com, adolescent development. And I'll talk about the mental and the health and the social and the physical, all that's going on, because they all are related. The hormones, the growth spurts, the, you know, hitting puberty, the difference between a biological female and a biological male. There's a lot of stuff you can learn. You can even do a consult with your primary care physician. Hey, this is my kid. This is what you've seen them since this age. This is what's going on. What's normal? Mm-hmm. You are a consumer in all of your healthcare providers, whatever they are. You have every ability. And these days you can email or text your doctor a lot of times. Mm-hmm. And then I think any book on psychology, on like, not, I don't want to say just psychology, but like on childhood development, it's going to be comprehensive. So it's a discussion with me, but most parents don't ask me like, what is psychologically normal or whatever. It comes up in the conversation. Like when I meet with my youth athletes, I also meet with the parents individually and like start to talk about that stuff. Mm-hmm. Because every adolescent's different.
Well, and I think what I find too is like, because there's still that stigma that exists, there's just a not knowing around terminology. And like we started this conversation around coaches saying they're soft, they're struggling, or they're suffering. Those are terms we hear. What are the terms you use in your practice that I feel like we need to be listening to people like you who have, you know, certifications and licenses around this kind of stuff? But I find even in the, like Rachel and I went to that conference, you know, when you go to these different conferences and different mental health providers are kind of there, even within the realm, they're using different terminology. And I think that is what confuses coaches. I know, like, we've had Dan Abrahams on, and he uses psychosocial. I think you use more of like the mental fitness, mental performance, mental health related terminology. Is there a right or wrong? Are they different? Like, what would you say to a coach or a parent who's asking that question?
No, it's great. And I think it's confusing even within the fields, and especially with someone who is duly trained like myself. What is the difference between mental performance consulting or coaching? So consulting and coaching can be similar, synonymous, and mental health care from the clinical side, from a holistic perspective. Two different degrees, two different professions, two different licenses and regulations and ethics and professional organizations, two different things. One person can have both. But for me, because I work in sports, like, it's going to be, I want it to be as similar to the physical sort of manifestation of what can happen, so that there's not much of a leap. So physical fitness, mental fitness, physical health, mental health, overall well-being. Depends on what we're talking about, what the presenting issue is. But I think if anyone is ever confused, ask that provider or practitioner, tell me more about what you mean by that. You know, unless you are a trained PhD PsyD, you cannot be called a psychologist or a sports psychologist. You can be a sports psychology professional, which I am. You know, so there's that nuance too, and that's in the weeds a bit. But if they don't have a license behind their name, they're not doing therapy.
Mm-hmm. Yep.
And you can have you can be a mental performance coach, sort of vetted by different organizations. Mine is the Association for Applied Sports Psychology, which is, you know, the most vetted and prominent organization. So I would like, none of my people on AthMindset, they are all pursuing or have that certification. And I wouldn't do anything else just because that's just me. And I trust this one. It's just, it's the most prominent, vetted, and most widely accessed certification through that organization. But people are trying to just, the words that you use, the words I use, are just trying to build a bridge between, and not have the words be something that's going to keep them away from a conversation.
Mm-hmm.
So when I say mental fitness, I'm going to break that down. When I say mental toughness, I'm going to break that down, because I do use both. Toughness is different now in this day and age than it was back in the day for the OGs.
Let's explain
Toughness,
that. Yeah, define that for me.
Toughness, what I've been hearing for the old school OGs is, you just put your head down and sort it. Like, just go for it. I don't care how you're feeling physically or mentally. You're going to do what I say, because that's what you're supposed to do when you're coached. You're going to be tough. You're going to grind it out all the time and not listen to your body or your mind or your thoughts or your feelings about anything, because we are here to win, and that's what you're supposed to do. You're treated, that is like robotic and inhumane, in my opinion. Okay. Now, mental toughness has become like, do you have the mental toughness, the mental grit to respond to a moment of adversity with a mindfully skillful response? So if you are in the moment of having intense performance anxiety, that is part of the game, like we talked about before. But if you know that your breath, if you take that, can bring you back to center, and I'm not going to geek out on the science, but like, you can breathe and it can bring you back to the moment and get you situated to then perform the physical skill at hand, or regulate the emotions. That's, to be able to do that, that's mentally tough. You're absolutely mentally fit. Mentally fitness, I like, because it's evolving. It's like, it can be here that you haven't arrived. To be more mentally fit makes you become more mentally tough. That's just what I use. But right now, this day and age, mental toughness is about responding to adversity and building resilience. That's what it is.
That is one of the biggest differentiating, like, things in this whole conversation that I hope parents and coaches hear. We are operating, I think what's the hardest part about this space, talking about mental skills, mental toughness, mental fitness, mental health, the terminology that coaches and parents are familiar with, these terms are redefined nowadays. And I think the biggest issue is that we are not asking questions on what does that mean for you, and how is that showing up for you. And I think, because like, up until what you just said, like, mental toughness, I don't love that word because I think of the definition you started with, which is, like you said, inhumane in my opinion. It's like how we were all trained to just push it down, not think about it, not deal with it. And I love your definition now. I think that these terms are what are aiding in the issues that we see in this space and aiding in some of the, like you mentioned, the mental health challenges or the mental fitness declining in our youth players because there's just a disconnect between understanding of what this all means. So, I love that you just defined that. That's huge.
Because the other one, Cassie, is language wise, and I'm a stickler on this one, the difference between grinding and gritty. Being grinding it out or gritting it out.
Define
Same
that.
kind of thing. Old school, everyone's gonna say, I'm on the grind. Even like non-athletes say it, I'm on the grind, just grinding it out, like 9 to 5, grinding. Like I'm over here grinding it out on this exam, to, like study for it, or this paper, I just gotta grind it out, whatever. On the field, I just gotta grind it out. What does that mean? Again, it's an old school synonym for toughness. I'm just gonna put my head down and just grind and grind and grind and not listen to anything and just keep going. Being gritty and having grit is the mindful, skillful way to approach what's before you, whether it's a big speech or a big exam or this tournament or this game. Grit is the preferred term right now, just like mental fitness, mental toughness, kind of redefining, reclaiming the power behind it and the empowerment behind it. That grit is like you training your brain to respond, knowing that your brain and realizing your brain has some say in this and like we can form it. It's a muscle just like anything else. We can form it and train it and strengthen it and they'll work for you. As parents, this is funny. I say like the brain is like a 2-year-old run amok. It needs guidance and oversight and feedback to behave that in a way that is safe and optimal for you. People don't know that we can shape that and train it. Just like we train our toddler to do the tasks that they're supposed to do, like poop in the right place, etc. So it's just this ongoing conversation and education. Now that you're learning it, anyone who's listening, how are you applying this knowledge in the role that you have as a parent or a coach, whoever's listening? How are you going to apply this? What is your to do now? Cassie's just not over here. We could chat over coffee if we wanted to, Casey, Rachel, and I. But we're doing this now, so you all have this information to now go do something about it.
Absolutely. I love that. I mean, the call to action is huge. And I think like if you're listening to this podcast, we do these types of conversations around educating around this topic or these types of topics often. And I think it is on the next step is, you can only have so many tools in your toolbox and be able to know what to do with them. But I love that you had a couple great experiences of what needs to happen, like how to take that information and run with it.
For sure. We have to, it only goes so far and it's only half of our responsibility if we don't act.
Yeah.
I mean, the other thing you had said too about learning, another free resources is like, I have a podcast too. And I want them all to be like informationals. I interview experts and coaches and athletes, former athletes. Any parent can tap in. Any young athlete can tap in and listen and learn. Also, that's what podcasts are for. That's why Cassie and I do it. Like,
exactly. Rach, did you have anything that you wanted to add as we wrap up?
Yeah, I just wanted to say in terms of takeaway, I think, listening to you guys, or especially Lisa, hearing your perspective, the big picture is for especially coaches and parents. We know players and youth are regularly learning, but reminding parents and coaches that lifelong learning only makes you better. And that's, I guess that's it. Just lean into it because the youth, the players we're working with in the youth space, it's a different world than it was. And those youth players are going to be adults, whether they're playing or not, but they're going to be, adults. And sports is a great vehicle for learning so many valuable skills.
Yes.
So educating yourself on that, because we didn't touch on it, but there's the whole social media piece of it, you know,
sure.
and parenting that a kid, and then now on top of it, an athlete, and are they going to be recruited, and how, you know, just like there's just the world is very different. And so educating yourself and not just saying, well, when I did this, I just did this, you know,
Right.
and
Right.
or this is how it was and this worked for me. Look at how I turned out. You know, people say that about different things, and it's like, well, that's great. And, you know, yeah, it helps shape who you are. Like, that's everybody's story in life. Like, your experiences shape who you are. It doesn't mean that you would have wanted those experiences if it could have been a different way, you know? And our kids are in a different system now. So we need to educate ourselves as parents, as coaches, to meet them where they are. You know, they are not softer. These kids know more about how they're feeling than ever. They just don't, you know, the system is really hard for them because the system, you know, some have changed, have been progressing, but just anyway, that's my spiel. Lifelong.
No, I love it. No, I love it. I do. I agree. And I think, like, Lisa, where can everybody find you? I mean, we know where we find you, but where can everybody else find you?
Yeah, thanks for asking. I mean, on Instagram, Lisa Bonta Sumii and AthMindset both have 2 accounts there. There's lots of information on there too, tips, resources. I'm on LinkedIn for the parents if you want to go there under my name. Those are the primary ones. Yeah. And I think I'm just gonna say this and be very, very what's the word? Like, unashamed. But like, I know Cassie's gonna put a link to my book in there in the show notes. I think about what you want to do for Mental Health Awareness Month. Even if you maybe pick that up and donate it to someone or a team, maybe whatever. Like, that's a resource that's so easy. Like, why would you not do that? I don't know.
100%. Of course, we're going to link everything. Don't worry. And yeah, I agree. Call to action. It's like, it's not just like, what I love about Mental Health Awareness Month is everybody is jumping on and we're all being a part of it. And it's like raising awareness. But I think I'm like you, or I get to the point where I'm like, okay, let's move past the awareness phase and let's get to the point where, like, we're actually calls to action. Like, we're doing stuff. So I love that you're challenging people to, what are you going to do? So thank you for that. I appreciate it.
Yes, of course.
And thank you so much for coming on. I really appreciate your time, and you're always so fun to talk to. You have such a great expertise in this and so much knowledge in this regard. So everybody check out AthMindset. If you work with us, we refer all the time to AthMindset. And we hope that you guys listen next week. So thanks so much, Lisa.
Thank you for having me. I really had a great time. It's always awesome to sit down and chat about these things that we both are passionate about. So I really appreciate it.
Absolutely.